Good afternoon, folks. We're glad you're able to join us for the last in a series of our webinars focused on improving patient experience in Virginia hospitals and healthcare systems, dedicated to the work we've tried to accomplish around the year 2020, Year of Patient Experience. My name is Joyce Davalt, and I am the Director of Performance Improvement here at the Virginia Hospital and Healthcare Association. I work with Abraham Segrist. He is on board, but just came in from traveling. So I'm going to be your organizer and presenter for our presenters today. Before we get started, we have just a little bit of housekeeping to make you aware of. The webinar is being recorded, and it will be posted later on our website. All of the participants are in listen-only mode, and we ask questions at the end of the presentation, and you can put them in the questions box. A copy of the slides is available for you in the handout section of the control panel to the right of your screen. Slides and recordings, as I said before, will be posted on our website under the quality and safety section. And there is a feedback survey that will be launched at the conclusion of the webinar, and we appreciate your input if you would fill out those very few questions that we have at the end. Moving forward on our agenda, we have presenters today from Inova Health System, Sean Smith and Heather Hunn. But before we move into their presentation, we also want to just quickly go over the goals for the 2020 Year Patient Experience. And as you can see there on the screen, has been to identify and highlight and celebrate efforts in Virginia hospitals and health systems to improve patient experience of care, to integrate by continuing to link and integrate patient experience improvement efforts with broader quality and patient safety improvement efforts, to connect, facilitating connections between our hospitals and health systems and other stakeholders for the purpose of shared learning, and finally to improve by supporting efforts to improve Virginia hospitals' individual and aggregate performance on national patient experience measures. Today's presenters are Sean Smith, and he is the Assistant Vice President of Clinical Enterprise Patient Experience for the Inova Health System. And along with Sean, we also welcome Heather Hunn. She is System Director of Hospital Services, Performance Advisory, as well for the whole Inova Health System. At this time, I'd like to introduce Sean, and Heather will follow with him. And Heather, I'll get ready to pass the mouse to you.
Good afternoon. It's great to be here with everybody. Heather and I are very excited to share some nuggets of information and our journey at Inova Fairfax Hospital, as well as what we're doing as a system to accelerate consumerism across the enterprise. I really wanted to take a moment and reach out to somebody who passed away this past weekend. And Heather, if you don't mind going to the next slide, I wanted to share a quote from the late Tony Hsieh, who passed just this past weekend. If you're familiar with Zappos or even their work around making happiness or delivering happiness, he was a brand ambassador. He was a customer experience champion. The quote on the next slide really talks about the need for organizations to want to build a brand. They shouldn't have customer service as a department. It should be the entire company. And I really relate that to the work in patient experience that we all do at all of our hospitals. We know that we may have a department, but it's the entire organization that truly makes a difference. Tony also inspired me by saying something else that we all know and we can all relate to. It was about, you can't build something great for the community or the market without having a powerful experience for the workplace. And Tony was an innovator in that space, and truly he will be missed. He's somebody that's influenced my life, influenced my career, and things that we do at Inova from a customer experience perspective. So next slide. Today, you're going to hear a little bit about our journey at Inova Fairfax. And I really, I love these slides because these slides really show the great work of our Fairfax Medical Campus. If you've ever been to the medical campus, it's truly a campus. There's several hospitals and institutes inside the campus that make it one of a kind. One of the things that I find very impressive that I continually praise the staff for is their consistent focus on quality and safety, maintaining that A safety rating, even among during COVID, as well as their 5-star rated CMS stars for quality, being the best in the DC metro area, as well as number 3 in the Virginia area, and 9 nationally for GYN surgery. Before I dive into Heather's presentation, I wanted to share just our view of patient experience. It's really about our mission, vision, and values, coupled with how we have clinical and operational improvement through the lens of quality, safety, and experience of care, along with caregiver engagement. We view high reliability as the cornerstone for patient experience, and patient experience is not making people happy. It's truly the connectivity between quality, safety, and experience that really drives improvement across our enterprise. So with that, I'd like to turn it over to Heather to share her portion of this presentation.
Good afternoon. I am a nurse. I have been here at Fairfax for 20 years now, and the first half of that was bedside nursing. And I really see how far we've come in that 20 years. But I'm going to start with the quote from Christy Dempsey. Many of you know her from the Press Ganey organization. And this quote really defines where we wanted to go 8 years ago when we really started up patient experience. We were called multiple things: patient experience champions, HCAPS champions, really focusing kind of on the wrong things at the time. But what we know is that we wanted to get to a place where efficiency, quality, our behaviors, all aligned with our mission, and it really paid its due to the caregiver experience and their engagement, because you can't do patient experience without that. And having these influences of dignity, respect, and treating our patients really as people and not a medical condition or a room number. That was our goal to get there, but it was difficult for our patient experience team. We were about 4 people at the time, and we were actually referred to as cheerleaders. It didn't help that we were all good-looking ladies, and we were positive, helpful, and reliable, but we weren't taken as seriously as we needed to be. We did birthdays, we did weddings, we helped with data, but we didn't really have a seat at the table when it came to integration and patient-centered care. So we needed a framework to get to where we wanted to go with our organization and get us moving in the right direction. And so this is what we really started looking at in terms of how we were going to approach our change. And you can see this reflects many other organizations or other systems thinking models, but really having a shared vision, measuring consistently and transparently, coordinated efforts, consistent communication with abundance of trust, and really setting up that backbone of the organization that allowed a continuous cycle of all of this to continue. But before we started with that, we had to have an agenda that really started with our culture. So this is a visual that we used at the time for our culture and our values, and how our experiences really shaped our beliefs on what our culture was. So initially we had a very organized, structured framework of values and beliefs where all leaders through various levels of the organization went through classes and became trainers. And this has been years and years of work and renewal. But what about when it didn't go right? Things don't always go right. We know that in healthcare. And so how are we holding everyone accountable, but building safe systems and also being fair? We had to learn about just culture. And so we went through classes on this, where again, we had train the trainer sessions, and HR helped us build a just culture algorithm so that we could really support our team members in reporting mistakes and feeling comfortable escalating their concerns. And it really improved our patient experience because our team members felt safer and more engaged in our organization. This is a slide from, at the time, how we were moving things through with our team members and really concretely identifying barriers to their beliefs and why we couldn't get to a new culture if we didn't examine those. So we really worked to shape new beliefs through our actions, very specific actions. And creating those new experiences helped lead to different beliefs. We did this on a variety of things, including communication, our no pass zone, which many of you are familiar with, around responsiveness and responding to call buttons, and really reframing what it was that they felt was a barrier to holding our new values and beliefs every day in their common work. We did that for many other activities, including what we call trio rounding. That's where we have physicians round with nurses and with the patient. That's the third piece. We also did it around our safety handoffs, our bedside handoffs, our hourly rounding, which we reframed to be purposeful rounding, and also the use of our whiteboards in the patient's rooms. Many of our team members believed that those really were for nurses to communicate to each other, and it really wasn't important for patients. And we focused it all around our mission. Something I want to point out in our care delivery model here is that we were really highlighting this sustaining model. Previously, it was just a focus on the tactics around the patient, and we had left out our team members. But it's important for them to know how their actions reflect on who we are as caregivers and what we're doing to support them. And this included team steps, lean methodologies, and visual management boards in every area, units, departments across the campus. And as click on this button here, we included our physicians in this training and all this understanding around how they impact the care delivery model, because at first blush, it often looks like nursing owns that. So we taught with our professional practice, with our chief medical officer and our other physician leaders, every chance we got, residency, skills fairs, lunch and learns, and staff meetings, what these pieces were and how to involve your patient in the care. The visual on the right side is something we called the 4 W's. It was part of the whiteboard that was removable, and we could bring it over to the patient to really help them understand why they're in the hospital, and that they were making progress day after day, even if it didn't feel like it necessarily some days. It was a big hit with our patients and also with our families, because it really helped them understand the care the second they walked into the room without waiting for a nurse or physician to come in. So as you all know, consistency is key. And again, this is from Christy Dempsey at the system, or at the Press Ganey, a slide that shows that when 90% of the individuals and 90% of the behaviors occur, only 90% of the time, we know that about 73% of the expectation is delivered. This is a favorite slide of mine. It really drives home with our team's outcomes, and I will often use clinical examples. So to say that 90% of individuals actually wash their hands, and 90% of the time we prep the skin before we insert a central line. And then 90% of the time we change a bloody bandage as soon as we see it. And that ends up giving you 27% infection rates. So these sorts of things really help people understand that you can't just do it when it's convenient, that you have to do it every time. So that's a great slide for anybody who wants to use it. We also showed our caring behaviors, our purposeful rounding, our leader rounding, our I-shaped, trio rounding, and whiteboard. All of these questions are asked on our HCAP survey of our patients. And compliance is not optional when it comes to our care teams. And when you look back to 2014, where we were with things like whiteboard, you really understand why we had the perception of our staff that whiteboards were really more for nurses and the care team and not for our patients, how far we had to go in terms of getting to consistency of using those and really talking to our patients and families about it. And then you'll see in 2020 that we, like many other organizations, not only in Virginia, but across the country, have been struggling with compliance on these behaviors for multiple reasons. PPE was a huge one. You know, everyone was trying to conserve PPE as much as possible. So not doing the purposeful rounding as frequently, not always leader rounding on people every single day. Doing I-shaped outside the room rather than inside the room. These things and even trio rounding, were difficult to keep up in 2020. Not to mention the exposure risks that all of these would call for. But what did the patient experience team do specifically? By the time I became director here at Fairfax, I had a team of 3. And so we really had to focus where we could control. So we worked on a lot of recognition. This is called the big ball of love. That picture there you'll see. It was actually something that came out in our gift shop around the Valentine holiday. And we took it and had people signing it, and then they would pass it on to a department or unit that they worked with frequently and had a recent good experience or wanted to say thank you for something. We also had the Daisy Award. The Peach Award was created here for techs and other ancillary team members. So we had both Daisy and Peach. We had a World of Difference card. We did speed networking, where our senior levels of leadership would come and talk to frontline staff, and they'd have things that they could talk about. They'd have anywhere between 3 minutes and 5 minutes to talk. It would ding and everybody would get up and move around the room. It was a great hit with our staff to get to know leaders that they see pictures of on the wall or see passing in the hallway, but have never really talked to. Including all our new beliefs, just culture, and our new values most recently. These things all fed into developing that culture that was driving a shared purpose and that trust that we really needed to develop with our senior leadership. We also went to radical transparency, and by this I mean with our Press Ganey and HCAP scores. At one point in time, our leaders all had access. So nurse leaders would spend hours in Press Ganey slicing and dicing their data, looking at it day to day when the N size was just way too small. We're a very reactive organization in terms of our HCAPS data. And, one day I would send a report, the next day a nurse manager would pull a report, and the numbers would be very different based on just a handful of surveys, or if they did it by receive date or discharge date. So we actually shut down access for everybody on campus with a limited few, and patient experience team became the source of truth. We sent out all reports. We sent them out on a weekly basis. We sent data and comments every time, and we CC'd everybody on it. So everybody was looking at the same reports. They all got it at the same time, and it really helped to decrease the reactivity, the mistrust, and, honestly, as finally some nurse managers finally admitted to me, it really gave them back time that they were wasting digging into the data. And it was right for the culture at the time. Of note, we recently gave everyone back access. So they are now all learning how to use the system and pull their own scores, but we're in a different culture now, and it's appropriate for that. We had a patient experience symposium. Sean talked about not about happiness, but suffering. So these are some of the things that we were involved in. We did a lot of engagement activities with our team members, food trucks. There was a lot of work with the senior leadership on things like this, and it showed that they were approachable and available. For our backbone structure, we really helped to create some of these ongoing things that are still in existence today. Inova Promise Stories were recognition stories that happened every week with our senior leadership. At one point in time, we were responsible for all of those. And now, due to our new culture, we rotate through everybody and the leaders come with their own stories. I can't dismiss the importance of Magnet and what that did for the backbone of our organization and sort of frameworks of staff engagement, nursing engagement. My entire team became Team Steps Master Trainers and taught the classes alongside quality and safety. That showed us in a light of serious professionals who taught alongside quality and safety and really helped us to develop a relationship with them as well. We were also part of the very first nursing residency program here at Fairfax, which has since spread to the rest of the organization. And I'm pleased to say that my team members were some of the very first facilitators, co-facilitators, who were not nurses. And that was a really important step in, again, developing relationships with team members and being seen as subject matter experts who could speak to all things, not just the data on an HCAP survey. Layered leader rounding, many of you know about that. Electronic leader rounding, I'll talk about in a moment. And we also invested in our unit supervisors. Those are the eyes and the ears on night shift, weekends, and when senior leaders aren't around. So I can't say enough about investing in them. Moving on, we did use Cipher Health, which is, or we do currently use Cipher Health, which is leader rounding tool. It helped drive a lot of our change. We invented something called the 360 round. So it's not just patient experience. There's quite a bit of quality and safety, Foley checks, central line checks, and fall checks in our rounds. We also were involved in a nurse clin-tech simulation. At this time, we only had 2 educators for the entire campus. And so it was important for us to support our nursing professional practice, and we were able to actually become facilitators in the sim labs and help debrief. We were actually nationally recognized for that. These are images from our promise stories. And finally, more on the backbone, we really needed settings for change to happen. So we were involved in new hire orientation and really embedding ourselves in that. We did change a lot of our units to have a medical director that was assigned to the unit. That dyad relationship for nursing and physician was very important for improvement specific to the units. Executive leadership walkarounds, secretaries, which I'll talk about in a moment. Physician ownership of the EDs and the scores. They really took that on and owned it. It was driven by the physicians there. We have now 4 adult family advisory committees for the entire campus, 3 pediatrics and 1 NICU. There was a great get together in February. That's that bottom picture of all the adult PFACs right before COVID hit this year. We have grand rounds where we speak, daily safety check-ins, discharge phone call program, which the patient experience team oversees along with a nurse navigator. And we created a patient experience position specific to the ED because we knew if our front door wasn't working well, patients' experiences overall would not continue to be good. A lot of focus work on secretaries, which I'll skip over for now. And then we all know that as much as you work on staff engagement and helping them to do the right thing, that there still is an element of uncertainty and fear in waiting and having unmet expectations. And so Florence Nightingale said it well, and that was something we needed to tackle. So we did a lot of process work as well, which initially doesn't seem very patient experience-y, but when these things are smoother, it absolutely impacts patient experience. And we went through all of the definitions of a highly reliable organization and really made sure that we were meeting these tenets in every way. So what did our outcomes get us? This is our top box for our likelihood to recommend since 2016. And you can see that we've continued on an upward trajectory. When we started really focusing in 2014, we were actually in the 60s. And by 2017, we were in the 70s. And into now the high 90s when it comes to the percentile ranking. And we're quite proud of this. Although we know recommend is really a lot of marketing and things like that, we also know that we really truly are getting better because our patients are rating us better in the 0 to 10 rating. And so when we started out in 2016, we were looking at 60s, and now we're in the 90s in terms of percentile ranking for this particular question as well. Now, have we done everything? No, absolutely not. But with limited resources and an unending amount of work, how do we make sure that we are staying focused? This was something that the team here at Fairfax would sit down and really assess and ask these questions of ourselves and our team, and make sure that we were continuously reassessing to make sure we were focused on the things that were going to really get bang for our buck. I'll hand it off now to Sean to show you where we're going.
Absolutely. Thank you so much, Heather. I loved Heather's slide from Christy Dempsey about 90% times 90% times 90% is 73% consistent. And we know when it comes to healthcare, we look for 100% perfection almost. And no one says it better other than Simon Sinek. If you're not consistent in the things that you say and do, no one will know what you believe. It couldn't be more true for today in healthcare. But I want to share a couple quick slides because I only have a couple minutes, but really where the organization's going. If you go to the next slide, really talk about Inova. We have a mandate of providing a people-centered, high reliability, high value, seamless system of care. We have imperatives for how we are looking at care in the future, looking at zero harm, psychological safety within our teams, knowing each person, connecting with them, collaborating in teams, and then using best evidence. We also talk a lot about shifts, and I like to talk about the shifts to require PX change, and we're focusing on the difference between patients and consumers, process focus to focusing on the emotional aspect, being a patient versus having a relationship with an organization, and looking at an encounter versus a patient's journey. Another really good shift that we've been talking about lately, which I'm sure you'll all appreciate, is a notion of hardwiring and really shifting that to heart wiring and coming from the heart, using that emotion for the relationship. As we begin our transformation, we wanted to re-energize and reconfigure the patient experience team to create a system service. And on the next slide, we'll show what that system service is. So our system service is really about bringing everyone together and creating that solution where we're providing expert advice. We're being those internal consultants for the organization, as our internal customer is the clinicians, the unit directors, and the physicians. When we look at that organization, we want to deliver comprehensive insights. Previously, the organization only looked at Frescani or survey data. We know that experience is multifaceted and comes in many forms. So we're using deep learning analytics to really understand the holistic viewpoint of the patient's experience. Part of our transformation, and if you go to the next slide, really talks about the development of our performance advisory function, and that is what we're calling our patient experience division. They're all of our consultants, and the performance advisor is really like a patient experience ninja, somebody that works vertically in their site of care or in their ambulatory network, but then controls strategy horizontally across the enterprise for a certain service line. So we have performance advisors working for 11 of our service lines, and then we have executive performance advisors working at in the region. So we have a central north or a central east and western region where they support multiple hospitals and activities associated with patient experience. And then everyone works with the PX Center of Excellence, which is our hub and operational standpoint, where we collect data, where we analyze, create best practice, spread best practice, and recognize appropriate parties. Recently, we've been really excited about the efforts at Fairfax as well as across the organization. We've been receiving the Patient Experience Award from Health Grades, and we just received several awards at the most recent Press Ganey conference. Two of them that I'm really excited about are the Leading Innovator Awards. Please, if you're able to go to Press Ganey, take a look at some of the work that Heather's team has done. The Inside Out program, a novel approach to disseminating vital information during COVID, as well as the Incorporating Patients in Relationship-Focused Telemedicine class. These were both programs that came to fruition during COVID, and we would love to share those with you. And I think with that, we'll turn it over to Carrie, and we'll be happy to answer any questions that come up.
Sean and Heather, we thank you very much for your presentation today. I'm going to check the question box here for us. If you'll just give me just a second to get the mouse back here. Let's see. No questions at this time. So I would ask Carrie Brady, who is our VHHA Patient Experience and HCAHPS Advisor, if she would give us a wrap-up discussion of our patient experience year 2020.
Absolutely. Thanks so much. I think that this presentation, it was remarkable in its own right, and also just a fabulous wrap-up for the entire year. We've talked all year about these 4 essential foundations for success. And so that's patient and family engagement, staff engagement, effective use of data, and leadership. And sometimes we've talked about them independently. You can think about them independently, but where they really work best is when you align them and combine them. And that's what we've seen so brilliantly done in Inova's presentation today. You have much greater impact when you align them. So if you go to the next slide, are you systematically considering all of the data and information you receive from patients and families? And I pulled out this slide from Inova because I think it does a brilliant job of showing effective use of data and patient and family engagement. Many times, organizations are gathering information in silos. So for example, it may be that the people that are doing your post-discharge phone calls, they know a lot about what communication is missing on discharge, what people are getting confused about, where the links in your continuum of care might not be as strong as you would like them to be. And sometimes nobody asks them those questions. So they may be resolving situations for individual patients, but you're not taking advantage necessarily in the organization of all of the profound insights they have about that particular piece of the puzzle. And what Inova has done here in the way that they're approaching it, they're gathering all of this information to get a comprehensive picture. HCAHPS really is only one tiny piece of the information that you have about what your patients are experiencing. And so taking a look at all the rich data and information that's available to you and how do you compile that in some way to make some sense out of it is a really valuable way to approach this going forward. If you go to the next slide, please, another way that we saw the combination today is about staff engagement and leadership. And it's really important, and it's wonderful to see that so many organizations are so focused now on staff engagement as being really critically important in any kind of patient experience effort, because if your staff are not engaged and they're not on board and you're not taking good care of your staff, you're never going to be able to get where you're trying to go in terms of creating those patient experiences that you're looking for. But one way that you can connect the staff engagement and the leadership is taking a look at, are you actually prioritizing your initiatives? And I love the Simon Sinek quote as well about, are we being consistent? Because oftentimes with staff, you know, you're throwing lots of different initiatives at them. They're all very well intentioned, but what Inova did a wonderful job all through their presentation today is this alignment. It's about, you know, what are your initiatives, but also what are your beliefs? You put just culture in place. All the things that you do to build that effective culture are what become the foundation for your success in patient experience. So if you are not going through a system where you're actually prioritizing your initiatives and asking some key questions, you're going to want to think about how to create that kind of filter in your organization. And also think about what are the current staff beliefs versus the desired staff beliefs. And that was an earlier slide that we saw from Inova. Really important to think about that, because sometimes what happens, and I've had many leaders in organizations, managers, and frontline staff say someone goes to a conference, not during COVID, obviously, but someone goes and reads an article or goes to a conference and gets an idea and says, this is best practice, and we are now going to do it. And they're all excited, and somebody else did it this way, so we're going to roll it out in our organization, without really taking the time to consider what is the actual staff belief in your organization around this particular aspect of care, around that potential initiative. If you don't know what that is, and you don't know what you're going to take to change those beliefs, then you're constantly going to be battling those beliefs, and it's not sustainable, and it wastes a lot of time and energy for everybody. So you want to think about how you're engaging your staff, how leadership is really listening to and having that continuous feedback loop with staff, so you're truly partnering on anything that you're doing and that it is aligned. And finally, we wanted to leave you with a couple of ideas for the best gift to give your team. This quote is actually from a nurse manager in an organization who said, not a Virginia organization, but an organization who said her list of things to do started as a dinner plate, and now she has a turkey platter. And as she said, you know, tongue in cheek, I like turkey, but this is too much. And her point was that she used to love to come to work. She loved what she did. She went into nursing for a reason and became a nurse manager and really loved it. But that at a certain point, it becomes too overwhelming, even if it's a good thing. There are just too many good things, and you cannot do all of the things that you're supposed to do. So one thing that can be very helpful for organizations, especially since we're wrapping up our year of patient experience, is take a year-end inventory of all of the meetings and initiatives that you have related to patient experience. And of course, if you've integrated them with quality and safety and other things, that's the best way to do it. You're embedding them in everything else. But there tend to also be a lot of independent meetings and initiatives that go on related to patient experience. Take the year-end inventory, celebrate and congratulate everybody for all of the work that they have put into this, even if the initiative wasn't successful. Because sometimes people put a lot of work into something and it doesn't work. And at the frontline level, nobody ever thanks them for the effort that they put in trying something. And if you don't thank them for the effort they put in, even if it wasn't successful, they're not going to be excited about coming back and trying something else. So you want to celebrate all of the work, whether it was effective or not. You want to thank the people who were involved. But then you want to take a look and see where you can align those initiatives. And we saw, I mean, through many of these slides with Inova, how things are really aligned through individual organizations at the system level. They are very consciously aligning all of these things. But in many organizations that have gone through this process, they have found hundreds of initiatives that nobody was entirely aware that certain departments were doing certain things or other things that if you align them, you amplify the impact, because maybe one department is trying something that the other department would want to know about, and so on. So you can align those efforts. You can sometimes combine some meetings, and you can also create some meeting free times. That's something that many managers have said, nurse managers in particular, that having some meeting free times helps them to get the work done. Because if they end up in meetings all day long every day, then there's not a lot of time to do the work in the hours in which you can access all of the people that you need to do the work. So you may want to consider setting up some meeting free times if that works in your organization. And as you go through this inventory and consider everything that you're doing and where you can align, you might see something that just isn't a priority right now. So you can free up some time and some space for your teams so that they have the energy to do what really is a priority, because there's a lot of, as staff have said, kind of throwing pebbles in the water, and that tends to cancel out the effectiveness of different things. So really, as we wrap up this year of patient experience, we wanted to leave you with some thoughts on how you can align your initiatives and amplify their impact, and engage everyone as you do that. But also, I wanted to share an observation about Virginia and thank everybody who has been involved. I have worked with hospitals around the country and hospital associations around the country. And in Virginia, you guys just year over year, and I've been involved with the Hospital Association for several years now, you are so wonderful about sharing your successes and being honest about what your challenges were and providing really concrete, detailed information to your peers that will help them move forward. And so I just need to say how amazing that is, what a wonderful collaboration that you have in the state of Virginia. And just thank you for all that you have done, all that you have offered. We've had wonderful presenters all year for the Year of Patient Experience, and I know that they've all done an excellent job, but I also know that all of our participants, every single one of you, goes into work every day doing wonderful things for your community, for your teams, and I just want to thank you for all that you're doing, because certainly 2020 has been an extra challenging year for all of you. And thank you for showing up and doing the work that you do, and really just creating safe, healthy organizations that serve your communities and a place where your staff can also be supported and cared for in doing their best work. So thank you so much.
Carrie, thank you so much as well for all of the commitment you've had with us and advising us and leading us in the right direction. We have been very blessed this year with many wonderful presenters, and we thank you all. Today, again, thanks Sean Smith and Heather Hun for a very excellent presentation. This program, I do not have any questions in the chat box or any questions in the question box. At this point in time, as you exit the webinar, please do complete the feedback survey for us. We appreciate your input very much. And we wish for you a very wonderful holiday season, and thank you for all that you've done in this very difficult year. At this point, the program is ended.
Thank you, Sean. Thank you, Carrie. Thank you, Heather.
Thank you, Abraham.
Thank you. Happy holidays.
Same to you all.
Thank you.